It looks like the plane is going to be delayed a little bit longer. The airline has lost the pilot's luggage. Isn't it time you got your pilot's license? Call Ocala Aviation today. 352-861-7484. That's 352-861-7484. Hey, you've earned it. Call today.
Ocala's information station, 1370 WOCA. Ocala.
All right, 5 minutes after 10 o'clock. Thank you for tuning in. We have Mark Shaw on the phone. Mark is the case manager for Dr. Juan Yordan's office down in the Villages. Mark is a member of the Foundation for Wellness Professionals, a health consultant to implement procedures. We've learned from our visits with those from Dr. Yordan's office, things from about geriatric care, orthopedic care, diabetes, medical weight loss. We learned something called platelet-rich plasma. All of the above, very interesting things happening in the world of health that you can benefit from. So if you have any questions, you are definitely invited to call in. Off the air, Mark just told me that he especially wants phone calls today. So let's find out exactly what we're talking about and say good morning to Mark Shaw. Good morning again, Mark.
Good morning, Larry. Thanks for having me.
Oh, you're welcome. Yeah, so many things you've brought to the table. Did you say today we're talking about pain?
Yes, well, we're going to deal with, we can deal with back pain, knee pain. I also wanted to touch base on plantar fasciitis and neuropathy and things of that nature. But more importantly, I want to invite anybody to call in if they have questions about it. We've had plenty of our patients on with you guys over the past weeks, telling them the wonderful results and different things. But there may be someone out there who, does this actually work for me or anything else? Or I have this unique case or this unique problem, which we deal with quite a bit with every patient that comes into our office going, well, mine is different and everything else. Does this apply to me? So I invite them to call in, ask questions, and say, hey, I've got my unique case, the bottom of my foot or my ankles or my knees or so on and so on have been giving me trouble for years, and would this work for me, or what can you do to help me?
Oh, absolutely. Okay, that's a great question. By the way, I also have the Facebook thing open, so if you want to send the message by Facebook, I'll be able to see it on there as well. And that's the News Talk WLCA Facebook page, just so you know.
So in dealing with pain, Larry, there are obviously many factors that patients deal with pain, whether it can be degeneration of joints, which very easily described is, you've spent your entire life walking around on 2 feet, and years and years of wear and tear and use and everything else makes the cartilage, the gaps, the spaces in between those joints degenerate, get smaller, causing it to touch nerves and cause extreme pain. A lot of people do not realize that, the weight of a dime pressing on a nerve reduces its effectiveness by 90%.
Wow.
So it's a nerves are very, as rightfully they should be, very sensitive. It gives us our sense of touch from pain. So any type of pressure on those nerves in any joints, whether that's from your SI joints, which are in your low back, to neck pain, to knees, ankles. What we just recently dealt with is tennis is a very popular game where we are, and we're dealing and getting phenomenal results with tennis elbow. So our golfers and our tennis people utilizing PRP or platelet-rich plasma are getting amazing results to where there was before, no real alleviating care that they could do. They could only do things such as Band-Aids, like cortisone shots or painkillers or ice or things of that nature, which doesn't actually, rejuvenate or fix joints. It just makes it, it's better for the time right now. It's not better into the future.
I want to bring something that I experienced to you, if you don't mind. I can walk pretty good. and I can sit pretty good. But standing still is when I notice it's almost impossible to stand still for very long. It doesn't feel like a joint thing. It feels like a muscle thing. What do you think that is?
Okay, so Larry, specifically, where do you feel the pain?
In the lower legs.
In your lower legs.
Yeah.
Okay. And specifically from that, from the knee down.
Yes.
Is it a burning sensation? Is it?
No. It's like really fatigued. You know, how like when you were younger and you would be exercising a lot.
Okay.
That's what it feels like, but I'm not. I'm just standing there. So yeah,
Okay.
It's crazy.
Yeah, and that could be, Larry, a symptom of the type of neuropathy, which doesn't necessarily have to be diabetic neuropathy. I've had patients who've had, neuropathy from just years and years and years, like I said, of use. It can be stemming somewhere from low back to neck to anywhere along the lines of your nerves that run up and down your spine, which cause it to, if it has pressure somewhere else, obviously, if that nerve runs all the way down through your leg, it was going to affect and have problems, maybe burning or fatigue or pins and needles, we've heard quite often, on your legs from the outside, inside, or from the knees down. The easiest way to explain this would be your brain, which controls everything in your body, from utilizing the nerves. It tells your heart to beat, your eyes to blink, your foot to take a step forward, and everything else, okay? And it does that through a system of telephone lines, let's say. We call those nerves, all right? So if you and I were speaking from Orlando to Ocala, okay, and we had all kinds of telephone lines all over, if one of those lines were to break or get pressure on it or have damage, it can cause us to lose a connection in Orlando or in Miami or in any of the other cities in the state of Florida, right?
Yes, absolutely, yeah.
Okay, so same thing being said with your body. Okay, if you have a low back disc or pressing on a nerve, or if you have degeneration in SI joints or knees or anything else, it's causing pressure or on the nervous system, which allows the pain to, say, in the foot. Or I've seen it from tension headaches to the SI joint, which runs down the outside of the hip and down the leg to the foot. I've seen many, many different types of pain, and that's what most people look at, and they think, okay, well, if I've heard one diagnosis, that means this is what it is. Mm-hmm. And unless I punch exactly on that on the radio, I have many patients out there who think, well, this may not necessarily be for me.
Right.
What we do is examine you when you come in, and we determine the root cause and where that's stemming from. So where exactly has a tree fallen on, so to speak, the telephone lines that are running throughout your body? We find that, and then we treat that instead of saying, okay, well, we're going to run telephone lines and bypass this tree and everything else. We take the tree and we remove it, and we, grow a new tree there and everything else, and so it's completely off of the lines, and they function as normal.
It's amazing. Giving
your body the ability to somewhat heal itself using its own properties of healing.
Yeah, it's amazing that you can. It's amazing that you can do that and that you can diagnose it that way. Because who would have thought that would have been the answer? There is another text message on Facebook, and it's regarding knee pain and supplements. Let me take a crack at the pronunciation: glucosamine, sulfate, and chondroitin.
Chondroitin.
Are they? Are they? Would you recommend that for knee pain?
Yeah, those supplements, I wouldn't necessarily recommend it for knee pain. Those supplements help throughout all the joints of the body, okay? And so the difference between what we do and what we utilize with PRP versus taking a supplement and using chondroitin or glucosamine is I activate the healing properties and I isolate it to that knee. Okay, if I were to take a pill, it gets digested in the stomach, goes through the bloodstream, everything else, and it's going to be, kind of like a shotgun approach to everywhere and every joint and everything across your body. Okay?
Right.
When I utilize PRP, I can isolate a specific part of the body, and I can say, okay, everyone has stem cells in their body. I can withdraw those using, just a simple butterfly needle and doing a blood draw. and I spin those down, and I can take those healing properties, so to speak, of a chondroitin which is just helping to rejuvenate those joints. I can take those properties and I can isolate that, and I can inject that back into the knee, allowing those properties to specifically stay there and those cells to turn into the cartilage or the damage and rejuvenate that joint in that area. So whereas I don't tell people, no, don't take chondroitin and glucosamine and everything for knee pain, that's totally fine. But you're looking at a long-term, I don't think that you're going to get very quick and specific results.
Injections is better.
From that, yes. Yeah. I mean, when I can isolate the problem and say, okay, there may be damage elsewhere, okay, in the body, but specifically right here in this knee, and I can have that effect and have that rejuvenation right here in the knee, and isolate it there, you're going to get tremendous results and fantastic abilities to regenerate that area so that you're no longer in pain.
Let's take a little break real quick. Mark Shaw is on the phone, and he is with Dr. Juan Yordan's office down in the Villages. We're focusing on pain today. If you would like to ask a question about pain anywhere in your body at all, we are inviting you to call right now, 622-9622. Of course, we'll give you Dr. Yordan's phone number in just a little bit, but right now, if you want to be on the air to ask a question, 622-9622, or if you're on Facebook, you can use that messenger thing, and it's facebook.com/newstalk.woca. That's our Facebook page. We'll take a little break and be right back with Mark Shaw. This is WOCA Ocala.
The weather is brought to you by myfwc.com. Safe boating is no accident. The high rip current risk continues through the evening hours. A mix of sun and clouds today. There can be a shower in spots along the coast. Thursday's high between 83 and 87. Clear to partly cloudy Thursday night, low 62 to 66. For Friday, partly sunny and warm, high 84 to 88. Saturday will be cooler and less humid despite sunshine, high 75 to 79. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Robert, how do you like my design?
You're designing a box?
That's not a box. It's a doghouse.
Rough draft for your rough? Sounds like you need personal service.
I do?
Yes, to print the blueprints. See Mark at the Personal Service Center. He can print blueprints, notarize permit applications, print and mail out invoices, and even provide great-looking business cards.
Personal Service Center. That's the one on the corner of Northeast 25th Avenue and 24th Street, right?
Just look for the yellow signs. Your pedigree palace will be a reality in no time.
Are you in need of custom screen printing, embroidery, or promotional items? Then look no further and come visit the brand new Legacy Team Sales. LTS is conveniently located off 17th Street next to Armstrong Homes in beautiful Ocala. We offer the best prices and highest quality products for your company, team, school, or nonprofit. Whether looking for screen printed shirts, embroidered polos, or travel team uniforms, you'll be sure to find it at Legacy Team Sales. Come visit our new 27,000 square foot facility. Our friendly and knowledgeable sales staff will assist you in every part of your custom purchase. LTS carries the hottest brands in the industry like Under Armour, Russell, Mizuno, Asics, Badger Sports, Gildan, Pacific, Ogio, and many more. At LTS, screen printing embroidery is done in-house and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
Hey, this is Matt Wilkerson with Verizon. Do you have teenage drivers or elderly parents that drive? I have what you need. It's the new Hum device by Verizon. Plugs directly into your car and sends alerts to your cell phone on the location, speed, and driving habits. And you set boundary alerts. You can call and speak live with an ASC certified mechanic. And if you have an accident and can't respond, Hum will automatically send for help. All this and more for just $10 a month. And if you're in Marion County, I'll even deliver and set it up for free. Call me 352-528-0020.
All right, 19 minutes after 10 o'clock, let's return to Mark Shaw on the phone from Dr. Juan Yordan's office down in the Villages. And if you want to call in, we do have somebody on hold right now, but if you want to call in, here's how it works. I just want you to know that nobody will say hello. I'll just simply hit the button, and then you'll hear Mark talking. And when he takes a breath, I'll introduce the fact that there's a caller. There's no way of knowing who you are in advance. We don't have any call screeners here. So good morning. Thank you for waiting. You're now on the air with Mark.
Hey, good morning.
Good morning.
How are you today?
Good. Did you have a question for Mark?
I certainly do.
Okay, go ahead.
All right, my name is Daniel, and I had a cervical surgery a few months back, and the pain has went down further into my neck, and I've talked to a few of my friends that had to have the procedure done, and they put a plate and 4 screws and whatnot in my neck, and they said it is not uncommon. I didn't get this from the doctor. I got it from my friends telling me that it could be re-injured up above or below the spot. You know, I had cervical 5 and 6 taken out, cadaver ones put in, screws and plates, this, that, and the other. My right arm is totally numb. The pain is excruciating, and I just want to make sure that this is not just something that is just a phantom in my mind. Okay. I've already went down and got another MRI done, and I got a great doctor here in Ocala, and he's sending me down for a nerve conductive thing.
NCV, or a nerve conduction test.
Right. And he's also saying something in regards to that might be carpal tunnel.
Okay. So, one, whether you've got it from the doctor or your friends, that is correct. So any place where I've fused the spine, okay, meaning that they've put screws and they've put plates in, each one of them would be, so to speak, like, for example, if we have a long telephone line system, we have the telephone poles that are holding it. Okay, let's call those the actual vertebrae running up and down your body. If I take 2 of those and I bypass them and I make them one, okay, and I pull the lines real tight and everything else through there, it's going to obviously put more pressure, meaning your spine is designed to move and give as you walk, okay? As you take a step every single day, each one of those is designed to be a shock absorber and to take pressure off the actual lines and the nerves that are running inside of that spine. So when I fuse 2 of those together with plates and with screws, it naturally causes no motion and no movement in those, okay, which would then put more pressure above and below on those particular telephone poles to carry more of the weight. Does that make sense to you?
It certainly does.
Okay, so that being the case, when that happens, yes, you potentially can have pain and discomfort and cause problems above and below on those. That is statistically why roughly around 70% of back surgeries and spinal surgeries fail and patients have to come back for additional services. What I would tell you is you're more than welcome. It's a free consultation to come in and to visit with us. As far as the pain and the numbness in regards to the arm and your right arm, with that being, as I was saying earlier in the show, if I have pressure, the weight of a dime, if you were to take a dime and put it in the palm of your hand, okay, the pressure of that dime, if it's pressing on a nerve, which causes, your brain has nerves running to the arm, telling it to close and make a fist, telling it to open and point a finger or touch something, okay? The weight of that dime pressing on a nerve can reduce the effectiveness of that nerve by 90%.
Wow.
Okay, so it's very likely, and it's possible, that being the case after that surgery and things of that nature, you've got some pressing on a nerve that is leading to the arm. There can be many different causes to this, mind you, and without examining you and having you come in and see the doctor, I can't give you an exact, okay, this is what's taking place. But that could absolutely be what's causing that pain. There are treatments and things that we can do. Last show that we had with Larry, we had a patient named Mary Ann who came in and very, similar circumstances to yourself, where she had had a back surgery and some nerves were cut and she had damage down her right leg. Where she had lost feeling. She had stopped playing tennis and everything else because she would obviously lose balance. If you couldn't feel your right leg and your foot, and you'd fall down and potentially hurt yourself worse. We utilized stem cell and PRP treatment on her, and that's not with every case. We told her going in, because of the surgery, if nerves are cut, this can potentially, not work. She said, I want to take a chance because, I've been to the Mayo Clinic, I've been to other surgeons, and they said, you'll never have feeling back again in that leg. There's just too much damage. After her first PRP, then a stem cell, and then her second PRP treatment, which we combined them, she is now if you've ever, had your leg fall asleep or anything else, and that, tingling and needles and stuff like that, she now is at that point where we're reversing the process, and she's now having feeling back in that leg again. Wow. So we can certainly examine you and have you come in, and it's a free consultation to you, where we can look and determine, okay, what is the severity of your injuries from surgeries, because surgery is a trauma to your body, and what are the severities of those, and what are your potential options as far as treatment to return that back to as close to normal. We've had in many cases where we get upwards of 85% of regeneration of joints and areas in the body utilizing PRP.
Can you, Mark, can you give the caller a number, address, and all that stuff?
Absolutely. So you can call and ask for Alicia.
This is something that I got to do. I can't live like this, man. It's just, I'm a roofer, and it affects every aspect of everything that I do.
Sure, it's an everyday part of your life, and normal functions. I completely understand that, and I would tell you, we can probably help you.
I would love to hear the end result of this.
Sir, and we can follow up with that. So let me give you a number to call.
Go ahead.
Okay, go ahead.
And it's 352-633-0473. We have two wonderful young ladies at the front desk. One is Alicia, and the other is Desiree. You may ask for either one of them, and they will get you scheduled completely free to you, and they will put you in our schedule, and we will examine that.
All right.
Okay, young man, I got 330473. We're missing a number.
You're missing the 6. It's 352 633-0473.
There we go. I'm missing the 6.
Yeah.
Absolutely. You've been such a big help and put relief at my mind so that I'm not going crazy, thinking that it's my heart, because I was
I'm so sorry about that. You're not going crazy. You're not going crazy in any way, shape, or form. And those kind of things can be very difficult to pinpoint as well as to get help, but we've got very wonderful results in that area, and it's very similar cases that you've dealt with.
Thank you for the call. So because of the radio show, we have to let you go, but I can't wait to hear. I can't wait to hear the outcome.
What?
Thank you. I can't wait to hear the outcome of this.
Okay, and I will definitely do it, and thank you for taking my call, and the relief that you just put on my mind is so great, it's not even funny.
That's awesome. I love that.
Wonderful. That's what we're here for.
You guys are the best. Thank you.
Thank you. It's oh my gosh, how good is that to reach out to somebody who can actually benefit that much?
Mm-hmm.
That's why we do it, Larry. I mean, that's what makes it feel good is somebody, and many patients have that exact same thing, Larry. They come in and they're just, and some of them even get to the point of apathy, like, well, I'm just going to live with pain.
Right.
And it's an awful thing that they don't have to.
Do you know, I want to mention something real quick. While you were talking, there were at least 3 other people trying to get through, but I wanted him to stay on so that we could get the full answer for him. And since we only have like a minute left, I noticed that you said free consultation. So can I just ask you to repeat the number so that maybe those callers, since you're going off the air in about a minute, that maybe they could just call you and take advantage of that free consultation?
Please do. You can reach, once again, Alicia or Desiree at the front, and it's 352-633-0473. It is a free consultation to you where you may come into the office. We will sit down with you, and just like that young man there, we will determine, okay, yes, here are your options. If anything call us, schedule the appointment, because if we cannot help you, meaning that the particular services that we do not work for you, we will do the work, and we will refer you to the correct person. We will send you to the correct doctor who can actually help you with whatever your problems are.
And if you're just tuning in and you don't realize it, Mark is in the Villages, so he's not far away. A drive to the Villages could change your life. Call us if you need the number repeated for Dr. Yordan's office. Mark Shaw, thank you that was an awesome show. Thank you so much for doing that.
You bet, Larry. Thank you.
That was a good one. We'll be right back.
Fox News Radio, I'm Lillian Wu. Presidential candidates last night tangling over issues like the economy and illegal immigration. Donald Trump calling the allegations of sexual misconduct against him fiction.
What isn't fictionalized are her emails, where she destroyed 33,000 emails criminally, after getting a subpoena from the United States Congress. What happened to the FBI? I don't know.
Hillary Clinton questioned